Hello, my name is Nicole Marwood and today I'm going to give you a presentation on multiple sclerosis. So we're going to look at what multiple sclerosis is, some of the signs and symptoms and how they diagnose multiple sclerosis, how they make treatment plans and then care, and how you live your life with it as well. So, multiple sclerosis. What is multiple sclerosis? So, multiple sclerosis is a disorder of the central nervous system which attacks the brain, the spinal cords, and the optic nerve. The immune system attacks the myelin sheath. So, this is a nerve, and on the nerve you have a myelin sheath, and this protects it. As it sends messages, and when it gets attacked, the myelin sheath causes inflammation and lesions, and that's what it looks like. So it gets attacked and it gets damaged. Once the damage is done, it cannot be undone. So generally MS is untreatable. It's something that people get and then they live with for the rest of their lives. And it makes it difficult for the brain to send signals to the rest of your body. Okay, so signs and symptoms. The condition is generally characterized by attacks and flares. So you will have all of these things happening to your body that will be making you unstable at some times, and then in other times you can go into remission. So you can have attacks and then you can be in remission for weeks, months, even years, and have no symptoms at all, which is quite interesting. And about 70% of patients live productive lives. So it still means that you have issues with your body, but you can still live a normal life most of the time. The initial symptoms of multiple sclerosis excuse me, include vague, non-specific feelings of weakness, fatigue and clumsiness. Things like vertigo, muscle-related symptoms, vision problems, bladder and bowel fatigue, cognitive dysfunction as well. And more than 50% of people with multiple sclerosis experience pain during the disease, and some of those pains can be rather extreme, and a lot of them commonly affect the face, the neck and the back in your body. Okay, so these are the symptoms that you may experience whilst you have multiple sclerosis, MS. And these are some of the things that might bring you to look at getting some help from a doctor and maybe look at diagnosis. So movement, balance and coordination problems, basically anything that has to do with balance and your body. Vision problems like blurred or double vision. Problems with your bladder or bowel, lack of energy and extreme fatigue. Lack of concentration and impaired short-term memory, extreme weakness. So I'd say that would come back to the lack of the energy, the extreme fatigue, and then the movement, balance and coordination will just make your whole body feel like you don't have any control over it. Shaking of the hands, paralysis in the body, and speech difficulties such as slurred speech. So now we're going to look at the diagnosis and treatment plans. Now, because there is such a wide range of symptoms and the condition itself, it could be very hard to diagnose. So if you suspect that you have it, you will go to your doctor, and your doctor will refer you to a neurologist, and they will do things like blood tests, MRIs, CT scans and lumbar punctures to check the levels of immune cells and proteins in the fluid surrounding the spinal cord. And those will generally always tell you whether or not you have MS. Once you have been diagnosed, your doctor will sit with you and you will start talking about making treatment plans. Now, because MS, generally no two cases are ever the same, not everybody's treatment plans will be the same either. Everybody will suffer from different types of things, but it generally has a large list of things that are always going to be happening. So it is important to regularly communicate with your doctor, especially when symptoms change. And the treatments focus on slowing the damage caused by the immune system that attack the myelin. Okay, so this is kind of the people that you will be working with when you are diagnosed with MS, and they can be a large group of specialists that know how to work with people that have MS, so that everything they do is to work alongside this. And they can be everything from physical therapists, occupational therapists, nutritionists, psychiatrists, pharmacists, social workers, and neurologists. Basically, there's a nice long list there. And you can see that all these people working together with you would be better to help make your life a lot easier whilst you have MS. Facts. So here's a few facts. 1 in every 1,000 New Zealanders has MS. So there are just over 4,000 people in New Zealand diagnosed with MS every year. Their symptoms appear in people in the ages from between 20 and 50, and generally diagnosis is around about 37 years old. And women are 3 times more common than men to be diagnosed with multiple sclerosis. Right, people from a Northern European ancestry are more likely to develop MS, and it is really found in Maldives and Pacific Islanders, and is very uncommon in the Asian families. Also, people are in cooler climates. Generally, MS becomes more common the further away from the equator you are. Thus, the prevalence of MS is much higher in regions such as the South Island of New Zealand, Scotland, and Canada. Okay. Working together with the patient. Individualised care plan. So a team of medical professionals work together with the patients and their loved ones, and they design a plan that works for the patient, the family, and all of the professionals involved. And they find the best medical care and building care for yourself. So multiple sclerosis sometimes can be quite detrimental on the body, and you might find yourself in a care facility, or you can stay home and get help with that. So HCA benefits of having a healthcare assistant at home could be things like they can help reduce falls, they can help you with your housework and cooking meals. Home healthcare assistants can help you adapt your home to fit your changing needs. So as the symptoms change and your body changes, they can help you do whatever it is that you need around the house, whether it be things like gardening, cooking, cleaning, and personal cares, most importantly. And you don't always have to be in hospital, so the best thing about being at home is that the HCAs can take notes and they can communicate with your registered nurses and help with those sort of things so that you don't always have to be in hospital. And it's nice to know that when you're at home, you can build healthy, safe, professional relationships with people. It's not always nice being sick, so when you have somebody come into your home, you generally want to get to know them quite well. And having an HCA that's always the same is good, because then you build better trust with them. Okay, So that's a little bit on MS today. If you do get diagnosed with MS, there are some MS Society places that you can go to within the South Waikato region. MS Waikato, which is in Hamilton, and Rotorua MS Society, which is in Rotorua. And there is some email addresses and phone numbers and physical addresses there. So yeah, thank you.